Is it okay if I record this introductory meeting? I've just put in the recording, so if anybody has an objection, let me know. I'm going to continue waiting for maybe another 2 to 3 minutes, and then we will start. I'm actually especially waiting for Dr. Arvind Bandhu, if he's there, to start the introductions, but if he's not, then I will start. Anybody has any comments, please chat them in, and I will be periodically looking at them.
Finance, ou soit dans le travail ou tout l'assurance, avec ou sans l'expérience, côté Alliance Services Mauritius, ça can gain ce sens. Si tu es content d'être bonheur ou tu es un loup-garou, et un carrière pour toi, nous. Tu es content de tracer, jouer et co-organiser, tu peux redonner une base que tu es capable de monter niveau et de montrer qui te veut. Fini. Côté Alliance Services Mauritius.
Was somebody trying to say something, or was that just the background noise? All right, I think we can get started. Is Dr. Arvind Bandhu on this call, on the Zoom meeting? Right, he's not. There are a couple of people that I know from my previous visits to Mauritius, and I'm going to rely on them to kind of keep me on track. So I see Oleg Milowski. Oleg, are you able to hear me? And can you unmute and just give me some feedback? What about Mozam Anwar? Either one of you?
Yes, I'm here.
Online?
I'm here. Yes.
Or
I'm
Nurina?
Yeah.
If you are, can you just unmute your microphone
you.
and just let me know that you're able to hear me, and I would like to rely on somebody there for feedback in case some problems occur technically.
Yes, we can see you.
Okay, excellent. And you can see the slides that are being shown. Like I've got the initial slide there. You can see the slide?
Yes.
Yes.
Yes, we can see.
I'm going to move the slide and you're able to see that?
Yes.
Okay, excellent. All right. So I don't want to wait too long because we have a few things to accomplish. So if you're just make sure that everybody is muted. Unless they want to talk, you can unmute and talk. But as a background, make sure that you're muted because I can hear background sound. All right, looks like Dr. Arvin has joined.
Hello, everybody. It's great to see everyone. I hope everybody's doing well. I see we have quite a number of attendees. First of all, let me welcome you to this meeting. And so my name is Arvind Bandhu. I think most of you, I've met most of you on our previous visits to Mauritius. And before we start this meeting, I would like to introduce our team members. And can everybody please mute their phone, because we have background noise and it's a little bit distracting. So first of all, thank you very much for taking time to log in. I think it's 8 p.m. in Mauritius, and here it's noon time. And I would like to introduce the members of our team. The first, I think the most important person to mention is Dr. Hussein. And Dr. Hussein is a professor of neonatology and pediatrics at University of Connecticut. And I think most of you have met him, and he has been an invaluable part of our team, and he has already contributed a lot to education, and he's actively involved in global health throughout Africa and India. So I wanted to thank him for all his effort and work that he has done so far. And on our previous visits, when we visited Mauritius, we identified a lot of areas where we can collaborate and partner, so that we can improve outcome of our babies. So so this is going to be our fourth medical mission in Mauritius. And with this upcoming mission, Dr. Hussein will be leading this mission, and he has put forward a training program, okay, that is called NNETS. And this neonatal essential training and skills program will be organized, and doctors, nurses, midwives are invited for this skill meeting. And I don't know if Dr. Moharbia is on this meeting. I wanted to thank him and the ministry also for supporting us, so that we can organize this upcoming meeting. I see there's a lot of people. There's like 96 attendees on this meeting, so that's fantastic. I hope we can have a great discussion in the next hour. And I also wanted to thank Dr. Bechu, who's also has helped to coordinate some of the things. So the upcoming mission is going to be the beginning of September. And I don't know if Dr. Bechu is on. I don't think he is on. But after this introduction, I will let you, Navid, take over. And Dr. Hussein is going to give an overview of the training program that will be organized in Mauritius, and the goals and objective of this program and what we are trying to achieve, okay? And then after the meeting, we will give some time for questions and answers.
All right. Thank you, Arvin. And welcome to all the participants in this NNETS program, which stands for Neonatal Essential Training and Skills. This program is conceptualized for use in low and middle income countries, and also places that do not have full resources. So we're trying to see how we can adapt this program to Mauritius, because it's not a low-income country by any means. It's a well-to-do country, but it has some limitations in terms of the neonatal resources. So having been there a couple of times in the past, I'm familiar with the different NICUs that are run by the government. And and the challenges that they face, both in terms of trained personnel and facilities that are available. And I want to congratulate you on the new NICU that has just come up, which I've not seen. It came up after I left last time, but I've seen some videos and they look excellent. Looks like state of the art. So that's a great advance. And I think a lot of you are already working on various aspects of neonatal care, both as from the doctor's perspective and nurses and nurse midwives. And this program is designed to kind of work with you in enhancing some of the skills. And the first part of this is actually just going to be some basic programs that we think are going to be important for everybody. And then as we move forward, hopefully the vision is that we will cover a lot of different topics and continue to improve the skills and training for the neonatal care providers in Mauritius. So with which we have recently developed for this program, and we have started using this logo for programs in other countries as well. So let me move on to the nitty-gritty of the program. But just before I do that, also, I had recently, just before starting this Zoom call, I put a pre-test on WhatsApp. So I put a pre-test on the WhatsApp. It's a test that you can take on your iPhone or computer. And it is basically a test to find out what your level of understanding for the different topics that we're going to cover, which is topics related to ventilators, use of nitric oxide, pulmonary hypertension of the newborn, neonatal resuscitation, and point of care ultrasound. Those are the topics that we're going to cover during this visit. And to begin with, it's good to know where you stand. So the pre-test is posted on the WhatsApp group, and hopefully you're all able to see it. If somebody can check and unmute and let me know if you have seen the pre-test, then I will be satisfied, and then you can ask questions about that later. I'm expecting everybody to do the pre-test right after we finish the session. Hopefully the session is going to be only 30 to 40 minutes, so you'll have about 20 minutes of the hour to finish the pre-test. And the pre-test will be graded immediately, and you will know the results score right away. But it's not going to reflect in any way about what you do in the future. This is just for us to know what the level of understanding is. So feel free to take the pre-test even if you know nothing about the subject, because that's the point. We want to see how much you know or don't know so that we can design our training based on that. So it's important for everybody who's participating to take the pre-test. And I think it'll be a requirement for people who want to get certified later so that we can show the change in knowledge and skills. So if you do not take the pre-test, then do not expect the certification. So make sure that everybody knows that. And if you have any questions about that, you can chat it in or let me know towards the end, or use the WhatsApp for communication. So the other thing I want to let everybody know that WhatsApp group is our main communication forum. So anybody has any question, put it on the chat, WhatsApp, and it will be, one of us will answer the question. So all the faculty are also on WhatsApp, and the 5 of us, and I'll introduce them in a minute. All right, so with that, I'm going to move on to the next slide. And at any time, if my internet is not working well or you're not able to hear, just unmute and say something. So the team that is coming over is constituted of 5 people right now. And hopefully if they're on the Zoom call, I'll have them introduce themselves. I'm going to start off with myself, just a quick introduction about me. I'm a neonatologist at Connecticut Children's in Hartford, Connecticut in the United States. I've been working here for over 30 years, and I'm a professor of pediatrics. But I'm originally from India, so I understand the culture in Mauritius very well because you've got a lot of people from India there. I think that's all I want to say, but I'd like to open it up now for other team members who are on the Zoom call and have them introduce themselves. So I see the name Sharon Wagner. She's advanced practice nurse practitioner at Baylor University in Texas. Sharon, do you want to unmute yourself and introduce yourself?
Yes, I'm unmuted.
Go ahead.
I guess we can say good night, everyone. I am Sharon Wagner's Dr. Hussein says, and I'm a neonatal nurse practitioner in Dallas, Texas, and I'm also clinical assistant professor at Baylor University School of Nursing. And I have been a nurse for over 40 years, and I am very excited to come to Mauritius and impart a little bit of my knowledge with you guys. And I'm very excited for this opportunity, and I'm sure you guys will enjoy it as we will.
Thanks, Sharon. And I see Rachel Koski on the Zoom call. Rachel, do you want to unmute and introduce yourself?
Yep. Hi, everybody. I'm Rachel Koski. I'm also a neonatologist, but over at the University of Minnesota, or Health Fairview. I'm an assistant professor, and I've done several other teaching at other various countries, and I'd like to welcome everybody. Thank you.
Thanks, Rachel. And I'm trying to see if I see Dr. Shilpi Chabra.
Yeah, I'm here. Hi,
Okay,
everyone. I'm Dr. Shilpi Chabra. I am from University of Washington, Seattle, and Seattle Children's Hospital here. I'm a professor of pediatrics and neonatology and in an academic center. So I am excited to come and impart my knowledge to all of you.
excellent. Thanks, Shilpi. I'm looking for Dr. Kiran More. Kiran, are you on the Zoom call? If you are, just unmute yourself and introduce yourself. Otherwise, I'll introduce you in absentia. It's difficult for me to see who's on or not, so I'm kind of scrolling down. I don't see Dr. Kiran More.
No.
Oh, are you?
No. Kiran.
Is it Dr. More? Okay, I don't hear and I don't see the name.
I
there,
thought
so-
he said he was here. Kiran, are you there? Just introduce yourself if you're there. Unmute yourself. Yeah, maybe he's not there.
Yeah, Dr. Kiran More is neonatologist who has trained all over the world, actually, starting in Toronto, Australia, Dubai, Oman, and other places, and finally is settled now in a place called Thane near Mumbai in India. And he's a world leader in point-of-care ultrasound training and has done point-of-care ultrasound workshops all over the world. And he has actually kindly agreed to come to Mauritius and train you guys over there in point-of-care ultrasound, and especially about how to evaluate the hemodynamics of a baby when you're dealing with a baby with pulmonary hypertension. But there'll be other aspects of point of care ultrasound that he'll be able to teach. And he has got a program that he can do some of these teaching online as well. So we're going to try to leverage that as well. So that's the team. Kiran, if you're joined later, just jump in. Otherwise, I'm going to move to the next slide. So the team members are basically going to be 5 people. And you've heard from 4, and I've introduced Dr. Kiran Mori as well. So these 5 are coming over to Mauritius. And this whole thing is, this program is initiated by Dr. Arvind Bandhu, but mostly it is the Ministry of Health and Wellness in Mauritius that has been, and that has the vision for these kind of programs. And the ministry, I think Dr. Bandhu has been working with Dr. Mahabir as well as Dr. Pradeep Bachu in terms of getting this organized. And I don't know if either one of them are on this Zoom call. If they are, please unmute and say a few words.
Hi, everybody. I'm Dr. Pradeep Bachu. Dr. Mohabia is not in Mauritius. In fact, he's gone on mission to China. So on his behalf, I'm the one who is talking. So thank you very much for this meeting, Dr. Hussain, Dr. Arvind and your team. And we wish it will be a success, this program, which you have been preparing for quite a long time. And soon we'll be meeting in Mauritius. Thank you.
Thank you, Dr. Bachu. And thank you again for your kind invitation for our team to come in and help with the training. And the other partner in this has been the Miru Foundation, which is a nonprofit. It stands for Medical Education Resources Unlimited, and that's a foundation that I work with along with the Center for Global Health at Connecticut Children's. And Miru has a website where we post all these training modules. So we had a NNETS program in Jamaica and Uganda. So if you go to the Miru website, you'll be able to see some of those lectures posted. And our plan is to post these videos also, these Zoom sessions also on the Miru website. So as we'll be recording each session on Zoom as we're doing it, and they will be posted for people who are not able to attend. And you can use YouTube to access those videos. So that's a kind of quick introduction to some of the people and the team. And now let me get into the nitty-gritty of the program. So, so the program is, at this point, we are envisioning that it's going to be 2 parts. The first part is going to be remote on Zoom-based talks, starting today, which is the 14th of August. And today is the introductory program that we are actually doing right now. But the plan is to do these sessions every Tuesday and Thursday at the same time, which is 8 p.m. Mauritius time. And so the next session would be a Zoom session by Dr. Chabra on the pulmonary hypertension basics. And then the following one on 21st August would be Dr. Rachel Koski talking about the basics of neonatal resuscitation. And then the 26th August program would be by Dr. Kiran Mori on the point of care ultrasound, the basics of what need to be learned before the practical demonstrations. And then that's going to be a session on the 28th of August by Dr. Sharon Wagner, a practitioner, who's going to talk about the nitric oxide basics, followed by a September 2nd program on ventilators that I will do. And these will be all basic introductory programs. Again, we'll try to adjust the level of training based on the responses we get in the pretest. And the pretest that you'll be filling out right after this session has questions relating to all these topics. And then after these Zoom sessions are done, we will have a post-test. And the post-test will be, again, required for all people who have registered who want the certification. And that will be administered on the 4th of September. And that will be also done around 8 p.m. And you'll have about an hour to finish the post-test. And that'll be online, just like this pre-test. It'll be online. As you respond by clicking, you will know your scores right away. And that score will be actually used for future. So that will be the real test at that time on 4th of September. Following this, our team is planning to be there once all the travel arrangements are sorted out. We'll be there starting on Monday, the 8th of September. And the plan is to try to cover as many hospitals as possible. And given that we have a short period of time and there are only 5 people, it'll be difficult, but what we have decided is we're going to split ourselves into 2 teams. So each day, one team would be at one hospital, the other team would be on a different hospital. So if you see can you see the slide with all the different hospital names? And I'm sorry, I've not had the 5th hospital. I know there are probably 5 or maybe 6 now, I don't know. But I have place for 4 hospitals that we would be able to visit during this session. So I combined the FLAC new or old hospital with SSRN, which I think are not too far, and then Victoria and G2 and JN Hospital. So the first session, Monday, I'll go through this just to kind of make sure everybody understands. So there'll be a morning session and an afternoon session. So the morning session, say on 8th of September, Monday, would be on POCUS at FLAC, and then on ventilators, nitric at the Victoria Hospital. It'll be a 3-hour session, starting at 9, finishing at 12. Then the team will move to the other place. So that same team will go to G2 for the POCUS session, and then JN Hospital for the ventilator session. So this way, we will be able to cover all 4 hospitals in a couple of days for all the things that they need to learn regarding point-of-care ultrasound and ventilators. And as I mentioned earlier, the point-of-care ultrasound is only for the doctors because they're going to be using the ultrasound, if at all. Not everybody, but whoever is interested. But it's a new technology that I would encourage all who are working in the NICU to learn about, because it can really help with your diagnostic acumen. So the first couple of days will be focused on point-of-care ultrasound and ventilators and nitric oxide. Then I've been asked by the ministry to do sessions on quality improvement. And so we're going to do the next sessions on quality improvement and neonatal resuscitation program. So the quality improvement is for everybody, nurses, doctors, nurse midwives, everybody, because for quality improvement, you need to work as a team. So I would encourage everybody to attend those. And then neonatal resuscitation programs are mostly for doctors, because for the nurses and nurse practitioners and midwives, there's another program called ENC. ENC stands for Essential Newborn Care, which is similar to neonatal resuscitation, NRP, except that it does not involve intubation and giving of medications, which the nurses don't do. So that's a separate program designed by the Academy of Pediatrics and now spread all over the world by WHO. So ENC is a WHO program which they have mandated that every delivery that occurs needs to be attended by a person who's trained in ENC. So that is the goal of the WHO. So we're going to try to do this combination of NRP for doctors and ENC for nurses. And based on, so I think, again, if there's anybody with an unmuted mic, just mute it. So those are the programs meant for people who are interested. And again, So NRP session, each session is 3 hours and will be followed by a certification of completion of the program. So you can get NRP trained in 3 hours. So you need to just attend one of the sessions. And even the POCUS and ventilator sessions, you need to attend one of the sessions in one of the hospitals. So it depends on your schedule and time, which one you can do and what you can arrange with your employer or your hospital, how much time you can get. We will leave that all up to you because there are too many people for us to coordinate that. So each person is responsible for their own scheduling, but you need to let us know which session you're going to attend. I'm going to send out another form which you will fill out saying which session you're going to attend, or at least try to attend. And then you need to get permissions from that particular place, whether you are allowed to attend or not. So those are the sessions, main sessions, POCUS, point of care ultrasound, ventilators and nitric, quality improvement session, a 3-hour session, NRP, a 3-hour session, and ENC, which is essential newborn care, is actually an all-day session. Because we're going to start from scratch, and nurses and nurse midwives will actually get a certificate of completion for essential newborn care, and that is recognized by the WHO. So that's an all-day program. So you just have to be careful, but for scheduling yourself. The morning part of the ENC is going to be more training. The afternoon part is going to be demonstration of skills and testing by using OSCEs, which is objective structured exams, and you need to do both parts to get the certification. So again, I know logistically it's going to be a complex thing, but we will leave each individual person to organize their time and schedule to see which one they can do. And right now I have 130 people registered, more than 130, but I don't know if everybody will be able to complete everything. So whatever module you complete, you will get the completion attestation for that. But somebody who's done all the modules that are required. So for doctors, it's POCUS, ventilators, QI, and NRP. They will get the NETS completion certificate. And for nurses, it's going to be ventilators, QI, and ENC. Nurse midwives, the same thing. And you'll get a completion for certificate for that. So that's the kind of the schedule. We're there from 8th of September to the 14th. That's the whole week. And then, this is the doctor's curriculum, ventilators, POCUS, NRP, and QI. And for nurses, it's going to be QI, essential newborn care, and ventilators. And even the ventilators and nitric is optional. And if you are interested in work with those things, you're okay to attend. If you're not, that's fine. You don't have to. But you'll get certification for QI and essential newborn care separately. So as I mentioned, we will provide a certification of NETS completion for those who attend at least 80% of the sessions, which is Zoom or on-site, and pass the post-test test. We will offer a post-test after the whole program is completed, and that post-test will be done on September 16th. And people who could not do the whole thing would get attestation of attendance for whichever module they attended. And NRP sessions would be individually, like each 3-hour session completion will be, we could provide a training certification for that. And ENC, which is essential newborn care, it's an all-day program, and there'll be a certification of completion for that if they pass the OSCE test and at the end of the day. So that's the vision of the program. We'll see how practically it can be done because it's a pretty tall order, but we'll do our best to finish the plan. So actually here I will pause and see if people have questions or you want to chat it in. I'm going to open my chat and take a look. So anybody wants to unmute and ask any questions? Right. Is everybody able to hear me well? Because I saw one of the chats saying that it is buffering. Was the internet stable and were you able to hear everything? Hopefully, yes. If not, I'll have to repeat myself.
Yes, all good.
All right. Anybody want to take just unmute and give me some feedback or at least about what we just talked about and any questions or just say there are no questions. I see that I got text that everything was fine, audio and everything is good. So that's reassuring. So any questions? Any of the hospital leaders that are there, do you have any questions? And does the schedule seem doable? I mean, it's a hectic schedule, but do you anticipate any logistic issues or problems? So one of the things for the hospital administrators, I would say, is that please see if we can identify a place where we can conduct these sessions. Because from the looks of it, if everybody who's registered comes, there'll be at least 25 to 30 people per hospital, per session. So we would need some place where we can gather and do the talks. We're anticipating most of it will be practical, but there'll be some projected slides as well. And I think we will work with the hospital administrators and leaders there to work out the logistics between now and the time we come. But if anything that looks grossly problematic, just let us know right now.
Hi.
All right, so I'm going to push forward to the next part. So the program that we're envisioning, so we're envisioning what we're doing right now as a pilot. So we will do basically August, September, this pilot, and then we'll look at the skills that have been there based on the post-test and your exams in September, and then see how you can implement what you have learned until next February or March, and basically do a follow-up evaluation in next March and see what needs to be done for the next cycle. And hopefully we can continue to do this cycle every 6 months to 1 year so that we can cover different parts of neonatal care, because it's impossible to cover everything all at once. And the vision is that we will do this cycle, and it may be a different team that comes next time. It may not be the same team, because taking time off as just purely volunteering our time, it's not feasible from our departments because we all have a full-time job. So, but there may be other people that come as the next part of the cycle to do the next part of the training. And so the training has components, which is the knowledge component, which we are going to test by the pre and post test. The skills component, which we're going to do hands-on training with ventilators, the nitric oxide machines that you have, the point of care ultrasounds, whichever hospitals have the ultrasound. I was told that at least the New Flag Hospital and then Victoria have point of care ultrasound available. They may not be using it, but we will train people how to use it. And if other places have it, we'll be glad to help them as well. Then the ENC program and will be tested by the OSCEs, so we'll know that you've attained the required level of skill. And actually, we have last time we came, we have trained a few master trainers in ENC in Mauritius. There are 5 of them who will be available to help us do the training. And then the quality improvement is envisioned that each hospital will have its own QI program. Last time we had come, we had done a QI program at the Flag Hospital, the old Flag Hospital, and it was very successful. We actually presented it at the international meeting, and it's being written up as a paper. So I'm not including Flag in the basics right now because they're going to the advanced level. But for the other hospitals, we will start a QI program based on their local requirements. For example, I know the SSRN issue with the infection, maybe be focused on infection control. Or maybe another hospital has something else that needs quality improvement. So we will ask you to identify your top priority for quality improvement at your center. And when we come to your center to do the basics, we would want you to all participate, doctors, nurses, janitors, cleaners, everybody who could be involved in the NICU to be part of that so that we can develop a program that is appropriate for that particular institution. Because quality improvement is not such something that you can apply universally. It needs to be specific for the place where you work. So that is something that we envision. And we have the list of all the people's names in the team right now. That is me, Shilpi Chabra, Kiran More, Sharon Wagner, and Rachel Koski. Okay. And then, of course, the on-site mentorship will be followed by testing and review. And then based on the review, we will kind of modify our program. And my vision is that we could, if we do some preliminary work, we may be able to actually apply for grant funding for future programs so that the Ministry of Health and Wellness will also be supported by an external grant from some big organization. USAID is probably not going to be functional anymore, but other foundations may be helpful. So that's the vision, and the steps in creating this vision would be the team, the trainees, the teachers, and the tests all would be involved. And over time, the longer term vision is that we would do a few cycles like in 2025, 2026, 2027, and lay the foundation. And then hopefully some of them people who are really interested can go on to do some more training, either abroad at our place or somewhere. And the following years, you'll go to a more advanced level, and then so on until you get to be a center of excellence yourself in Mauritius. So that's the kind of the long-term vision, and only you can make it happen. So we will help you if you are interested. So with that, I think I'm going to stop. I was going to talk about our plan with essential newborn care. I'm going to just quickly run through the slides. I'm going to give some time for questions. So the slides, the essential newborn care, the vision is that we will reduce birth asphyxia in Mauritius. And it's based on the Helping Babies Breathe program that has been adopted by the WHO. It's been running since 2010. And the plan is to train people, but then also train the local trainers so that you can continue the program without us being there. And so I'm going to skip through this, but basically the plan is this. So it's called the dissemination model for ENC, and that's how it is recommended by the WHO. So initially we'll come in and train, say, 15 providers, of which 5 will be instructors. I think we did this part already last time we came. So now we have 5 instructors. Each instructor can instruct or train another group. And so that'll multiply to 75 providers being trained in the next session. And then we'll select some as instructors from that and then go on. So over time, in like through 2 or 3 cycles, every single person who is going for newborn resuscitation or going for attend deliveries, either nurses, midwives, or doctors, should be able to be ENC trained and certified. And that's the goal of the WHO, and then we'll make it happen for Mauritius. And so the only way to get started is to just quit talking and begin doing. So I'm going to quit talking right now. And let us kind of open this to questions, and people can chat in their question if they don't want to talk. Questions from some of the leaders who are there? Anything? Arvin, Oleg, Omir, Nurina, people that I know, I'm calling on them. Just unmute and say something. So I know at least you heard it.
Nabil, that sounds outstanding, the program and the vision that you've laid. I think having been in Mauritius, I think you know exactly the challenges that we have firsthand. And I wanted to point out again the QI project that was done at Flack Hospital that was very successful. I think the team in Flack kind of, everybody kind of understand that one of the ways to make improvement is through QI quality improvement methods. So the one comment I was going to make is the scheduling, the morning session and the afternoon session. So we have like five NICUs in Mauritius. I think I would ask the team in Mauritius to kind of coordinate between themselves so that they can attend this training session. And I think it's an amazing training program that you have set up. And I think QI would be very nice to institute a QI project in each location. And also, I wanted to stress again the importance of doing the pretest. If people can do the pretest, I think that's very important for us to identify areas that needs more training and more, so that teaching can be geared towards those areas where people needs more training on. So if everybody can please do the pretest, and the pretest is, there's no failing or passing there. It's just a pretest for us to know where the different areas that we need to concentrate.
Any comments from Dr. Bachu? Since you are the leader there and you have a vision of what we need to do, does this make sense to you?
Yes, Dr. Navid. It seems a very extensive and intensive program. I wish we succeed in this. And we need a lot of work in Mauritius. So I'll try to contact all our consultant in charge so that we can come together and see how, if we can combine some, because 4 places it will be going on this program. It seems we have to move quite a lot. But as at Flack Hospital or the new Flack Hospital, I think we are in the process of preparing how we'll proceed. And other CICs who are online now, I think even they will be having ideas how we can go. And all the medical doctors, we are, nursing staff, everyone, we are very keenly waiting for you people to come and we start this program very soon. So let's wish we meet soon in Mauritius. And in the meantime, we'll just go, you're planning whatever you have done. We'll be able to establish something in Mauritius and we'll proceed with the training. Thank you very much on behalf of all Mauritian staff, medical, nursing, everyone. Looking forward that we meet soon here. Dr. Mohabir will be back to Mauritius, I think, next week. And he's in charge of the training part. The curative part, there is Dr. Nao. And I have informed him soon he will be getting the program because he's in charge of hospitals. So he too will be on board to prepare your visit to Mauritius with your team.
Thank you. It means a lot because it has to, if the administration is in sync with what we have, I think then things will go smoothly because we do not understand the logistics of how things work there. You do, so we will leave it to you we have just created the vision, but making it happen, I think, is more dependent on the local people, and without you, then it's not going to succeed.
No, so it's a team. It's a teamwork rather. From your side and from Mauritian side, we have our team, all our consultant in charge who are very keenly waiting for you people to come from all the 5 hospitals, our pediatricians, our medical officers who are working, even our nursing staff are very keen to learn more, whatever going. Just recently, today, I think we came across something that our infection control is working very well at Flack Hospital. It means a new Saj Hospital. So it has been really great here. And I think Dr. Omia is online if you wish to say something. Muazzam is online. So if he wants to add something, he can add.
Go ahead.
Thank you, Dr. Bachu. Hello, Dr. David.
Hello, yes. Thank you. Go ahead, Muazzam.
Yeah, so we are also looking very forward to meeting you. Dr. Vichu is supporting, and we have already started preparing some place like where we'll do the projectors and where we put the projectors and do the meetings. And we just hope that we meet soon. And for those who don't know about QI projects, you know, like it is something that we ourselves we didn't know before. The first time you introduced this to us, it was looking a bit boring, the way you were explaining that we should do this, we should do that. But then when we applied it, we found it was very, very helpful for the babies, and it was really successful. So I would encourage all the teams to start at least one small QI project, and they will see good results. Like quite, it it will bring positive outcomes to their NICUs.
Thank you. Thank you,
Thank you,
Moses.
and we hope to see you very soon.
Yeah. Anybody else has any comments?
I see some good questions, Navid, in the chat.
Okay.
So one of the questions was from Shabra, who asked, it would be nice to hear expectations from the learners too. So do they have to prepare on something, do some reading before your arrival and the training? What would you recommend?
So yeah, so for each of these modules that we're doing, we will have some material that we will send so that people can come with a little bit of a background. So you don't have to start from scratch. That's called the flipped classroom model. That's something that I think would be helpful. But it's only helpful if people do the preparatory work. But we're hoping that since people are so enthusiastic, so what will happen is with each session, before each session, at least a day or two before, we'll send some material to all the participants through this WhatsApp. So if it's like a PDF file or some link to a resource online, we will put that in and expect the people who are participating to at least go through that. So when they come to the sessions, they'll be prepared. So that's part one. And then the other materials that people want from us, I think, again, the WhatsApp chat group is a good forum for you to kind of say, you know, we need to know more about this particular topic or something like that. So that way, what we are preparing in terms of this curriculum can be more focused on what your needs are. So that's what I would say.
Yeah, thank you, Navid. There's another good question from Sharon, who's asking, is the intent to have each hospital come up with a QI project and have a faculty member overseeing this project? Because like Dr. Omia mentioned, the value of QI project, maybe this is something that could be useful if each hospital can start with a small project.
Yeah, I think ideally it'll be like each hospital does their own project, but with a mentor from our group. So it could be a different mentor for each different hospitals, or we will, within our group, I think we will figure out who is interested in being a mentor. And then but there'll be a mentor for each hospital who would be available as a resource. You can talk to them, ask questions, and work out the nitty-gritty details of the QI, because QI is a lot of detail work. So there needs to be a mentor.
Absolutely. There's one, I think it's more like a comment or a request from Modobakas Yasmin, talking about people getting released from their clinical duties to attend those sessions. I think what I was going to suggest is, for example, the sessions are going to be done at different hospitals. Maybe it will be possible, maybe for Dr. Bechu and the ministry to organize so that if, for example, somebody is working and is not able to attend, they could come on a different date to a different hospital to attend those sessions so that everybody can benefit to a maximum from those trainings, so that people who are involved directly in the care of the babies, they have an opportunity to attend those training sessions.
Okay, we'll take up the matter with Dr. Moabia since he's they're in charge in the ministry for the training. So if official release can be there, I'll just convey the message to him and
Yeah.
he will monitor.
So that's a good
Yeah.
point.
That will
And
be,
thanks
we'll
for
take care of that.
Yeah. So the other part in that is the last couple of days, the Sunday and the Monday, which some of the team members will be flying away on Sunday, but Monday and Tuesday, some of us are still available. So if there's a big demand for a particular thing to be repeated, we could certainly do that on those 2 days, which I've kept a little bit flexible. So there could be some like refresher sessions that time. And we could do it in a neutral place like the conference room of the hotel we're staying in, so that people can come in and don't have to go to the hospital to do that. Stuff like that. We can discuss that more in detail in the next couple of weeks. But I'm keeping a few sessions open for people who have missed and really want to do it. All right, looks like it's almost towards the end of the hour. Any of the participants have any comments or thoughts? Even after this meeting is over, just continue to put it in the chat on the WhatsApp so that we can continue to have a dialogue. And I don't want it to be like a one-way street that we're teaching and you're just taking it in. I think it needs to be, we need to teach to the topic that you are interested in, not just what we want to teach. So that's why it's a two-way street, that you keep the dialogue going.
Hello, Dr. Hussein.
Hi, Naveen.
I wanted to ask, one particular topic that I'm really interested was nutrition. We still have the issue of how to start, the amount to start, and not having the protocol set up yet,
Yeah.
in each hospital, especially with the very beginning, when the baby is born,
So
like
it's
the first few days where
Yeah.
breast milk is not available and stuff like that.
So the
Is-
topics that we have selected is based on the requests so far. But what we could do is some of the things that are really important at your center, we can do that as part of QI.
Yeah.
So, yeah.
And another thing, as far as the POCUS is concerned, we are really happy to learn how to do bedside ultrasound. The only thing is we wanted to know the legal aspect. We are only RMOs, as you know, like residents. Is it like, like writing in the notes of the patient, having seen such and such things while doing the echo,
Yeah.
we
So
have
that's-
the right to do, or is it
that's
just guiding us in?
beyond the scope of my thing, but that's a local issue. But the way we think about POCUS is like how we use a stethoscope, okay, or ophthalmoscope. You use it as to get some information from the patients. You're not doing an ultrasound like a radiologist is doing to make a to bill for it or to give a report. You're not giving a report. You're just using it as a tool for evaluating the patient. So that's how it's being considered. But again, that's your local health people that have to decide how to use it. And if it is not helpful, then that is your decision. I think we're going to just introduce that as a tool that you can use.
Yeah, I think people who do POCUS anywhere in the world still now will put a disclaimer that this is not an echocardiography or something done by cardiologist. This is just, as Dr. Naveed said, really like a vital sign use, like you take a blood pressure, or you take the heart rate, or you look at the SATs. So it's not an official read or an official report by you. It is just to help you guide your management in the middle of the day, or I'm sure you have echo your cardiologists who are doing echo for you. And then, lung ultrasound to help decide, do we need to give surfactant or we don't need to give surfactant? So it's really just something to help make medical decisions in your day-to-day care, not necessarily a report, etc.
Okay, thank you.
All right, I think we will have to stick with time. So we'll start on time and we'll finish on time. So it's just about 1 o'clock here, which is probably 9 p.m. over there. So the rest of the questions, please put it on WhatsApp and we will answer them. Make sure you do the pre-test. And as I said, it's a requirement for anybody who wants to get any certifications. So people who have not done the pre-test now or not attending this session can do it later. I get a time-stamped entry automatically, so I know when people did it. So I'm going to keep it open for the next 24 hours. But I would like people to do it in one sitting without consulting anybody, because the point is not to get the question right. The point is to know how much you know. So with that, I think I'm going to stop. And thank you, everybody, for making this so overwhelming in terms of the number of participants. I didn't expect so many people to come. But that shows the level of dedication to improving neonatal care in Mauritius. I'm really excited. And I think that our team members are all very excited to be there. Hopefully, we will not get any cyclones or hurricanes, but apart from that, it's always good weather in Mauritius, right?
I wanted to thank you again, David, and thank you for the team that you're bringing. And thank you, everybody, for attending. Have a good night, guys.
Bye.
Bye-bye.
Bye. Bye.
Thank you. Bye.